We are at the Office of the Aging in Albany, New York. We are with Greg Olson, the director of the New York State Office of the Aging, and we are going to discuss something that is very powerful, extremely important, and that is addressing elder and senior isolation. It's an issue that often goes unchecked, and I'm hoping that this conversation can change that. So first of all, thank you so much for your time. We appreciate it.
Thanks for having me. It's an important topic.
What is the New York State Office of the Aging for those who may not be aware?
So we oversee a network of 59 county offices for the aging, work with about 1,200 community organizations, and our mission is to help older adults stay as independent as possible for as long as possible. So we serve older adults, about 1.5 million a year, but we also work with families because many family members are taking care of an older adult, but we also have over 300,000 grandparents that are taking care of grandkids. So that's our job. We're in the community, help people stay at home, happy, healthy, live with dignity.
Let's talk about depression and feelings of isolation in older citizens. It's very real. Has it always been this way? Has it gotten worse recently, or do we see more of it now because social media is shining a light on it?
It's all three, yes.
Okay.
So our original charge is the 1965 Older Americans Act, and combating isolation is actually in there. And there's a variety of things that we've done for 40, 50 years to address isolation, getting people out to a community setting, providing transportation, friendly visiting in the home, telephone trees, things like that. Did it get worse with COVID? No question. And not just for older adults. Actually, older adults are a little bit more resilient. It's been equally, if not worse, for children and for middle-aged individuals. So this is not an older adult phenomenon, but certainly does impact a lot of older people who are living alone out there, and there's a lot of them.
Speaking of living alone, I'm sure this is obviously one of the factors that contributes to it, but can you talk to me about more factors that contribute to the loneliness and isolation?
Yeah, I mean, your life when you get older can change significantly. Death of a spouse, not working anymore, losing those social relationships at work. I mean, that's a huge part of what we all do. Could be my own physical functioning, could be a stroke. So there's physical things, there's economic things, and that really has a big impact on people as they get older. They're seeing their friends dying, looking at your own mortality. So those things can definitely depress you and further isolate you. We have 1 million people nationwide that give up their keys every year for a variety of reasons. Anywhere in New York State, around the country, residential homes and commercial are not together. Sprawl and suburban living have really isolated people, and when you don't have access to your car, you are extraordinarily isolated.
Can we touch on that? In rural areas, it seems it can be more complicated for our seniors. Should neighbors watch out? How do you get neighbors to become involved?
Yeah, I mean, a lot of these solutions, to be honest with you, are so no-brainers, right? Picking up the phone if you have somebody in your family or a neighbor. I mean, when I grew up right around here 30, 40 years ago. You knew who all your neighbors were. It is not like that anymore. People don't know who their next door neighbor is, or you're afraid to engage. So there's some very simple things you can do. Reach out to somebody, make a phone call, ask somebody to go out for a cup of coffee. But then there's a lot of other things that we've implemented using technology to really combat isolation as well.
Not every senior has a car, as you stated. Not every senior is able to get around. For those who can, are there places they can go? Can they remain physically active? Can they engage in new hobbies? Talk to me about that.
Anybody can do that anywhere, anytime. And those are things that we offer through our network, but the communities do as well. There's community calendars of events. There's socialization activities. You can go to a senior center. We do provide transportation for those that don't have it to get out to those types of things. So again, not an age-specific thing. There are a lot of things going on in the community that I think people need to be educated about and can certainly go. But there's also opportunities, again, with the expansion of technology and just really smart people developing really smart tools that can balance, if you may not have a human being in your life, with finding human beings through other means.
This is why we're doing this, because you're educating us. And one of the things you said that I didn't even realize is you can get transportation to these folks to get them to senior centers so there's more socialization. Do you find them participating?
Yeah, the pandemic has had a huge impact. Most of our senior centers across the state are open, but we still have quite a few rural counties in upstate New York that didn't for safety reasons. Have also lost staff involved volunteers. So I think that there's also a fear, and rightly so, with the flu, which has been really bad this year, RSV, which seemed to come out of nowhere, and now this new variant of COVID that people are making wise, healthy decisions not to go back into settings that may get them sick and kill them. So we're seeing people going back, but there's also less people who are going back because of some of those fears.
So Greg, some of these seniors, as you stated earlier, they lose their sense of purpose, and that is a massive challenge. What are some of the benefits of them working a part-time job or even volunteering?
Yeah, and that goes back to the work thing, and you're absolutely right. When you retire, people are excited to play golf or go on a trip or do whatever might be in the front of your mind. But then that ends, and what do you do every single day? There's purpose to work. There's purpose to volunteering. We're so centric on work in this culture. So people could go back to work. What you do is you create another support system, right? The people that you work with. It could lead to dinners and coffees and things like that. Volunteering is huge. What a great way to give back. We have 1 million volunteers in New York that provide over 495 million hours of service at an economic value of $13.8 billion. Many organizations are looking for people to help provide service. You could interact with anybody of any different age. But you're absolutely right. Having a sense of purpose is a game changer for depression, loneliness, anxiety versus not when you stay connected.
Are our seniors proactive? Are you seeing this when your caseworkers go out?
They are, but it's like any group. There's going to be people that are not active, will sit and not do anything for a variety of reasons and have a negative impact. And then there's people that step up, and that's the nature of any individual person. You can't kind of group them together. It's kind of all over the map.
Let's talk about one of your programs that's delivering meals. How does that help these seniors? How do they get involved with it?
Well, that's critical. We always need, so let's talk about the value of the meals, and we'll talk about the value of the volunteers, because we run the largest nutrition program in the country in New York State. We have over 2,400 home delivered meal routes. And so in order for somebody to get a home delivered meal, they have to not be able to shop, prepare, or have somebody that can help them. So they're very frail. And food is medicine. Without these meals, these individuals would not be able to stay at home. They're all registered, RD certified at the highest levels. But to make the food and deliver it, we rely heavily on volunteers to make the meals, to deliver them in most parts of the state, and to be the check-in. For an older adult, getting a meal might be the only person they see all week. And that's sad, but it's true. So we could always use volunteers to help get those meals out the door or in a congregate center.
For caregivers taking care of their loved ones, it seems like it would be obvious when they would recognize it's time to step in and get help. When people call the office, are they struggling with where to begin?
They always are. So what we say is, I hear all the time, your network doesn't do a good job doing outreach. That's not true at all. You don't need what you don't need until you need it, right? I don't need to know about Star property tax rebate until I buy a home. I don't need to know about TAP and Pell until I'm sending my kid to college. That's how this works as well. A couple of things. Older adults have the right to make their own decisions. So a lot of times we will talk about what we have available. We could do an assessment to see what their strengths are, where they might need some assistance, but then it's ultimately up to them whether they choose the service or not. Sometimes they do, sometimes they don't. For a caregiver, oftentimes it's crisis driven. Mom or dad's in the hospital, they're being discharged this afternoon. Who's going to take care of them at home? And then hopefully, what we always tell people is you don't have to know all the services we provide, but the first place to call is your county office for aging. They're not selling a product, they're selling objectivity and help. And then the customer can decide.
Well said. What are evidence-based interventions and how do they play a role in senior care?
Yeah, so evidence-based interventions are things that if you stick to the fidelity of the way that the program was designed and implemented, so all, steps A through C, that you will yield a result. So there's a lot of evidence-based interventions, things that help you control diabetes, falls and injuries, strength training, powerful tool for caregivers. There's lots of them. One is one of the most popular ones. It's really important. It's called chronic disease self-management. We know that chronic diseases are the most preventable, but also the most manageable conditions people have. It's going to cost $1 trillion by 2045. So how do you control your hypertension, your blood pressure, your weight, right? That's the types of things that chronic disease self-management and some of these evidence-based interventions do. What that's designed to do, again, is help people stay safer by being more healthy so that you can stop them from declining where they wind up in the emergency room. And if you're able to control your diabetes and your blood sugar and your blood pressure, that's going to yield positive results as you get older.
So we need to be proactive as caregivers. We need to be proactive as seniors.
We all do. We need to, all of us, we need to eat as well as we can based on our budgets. You need to exercise. You need to not smoke. 60% of all healthcare costs have nothing to do with healthcare diagnosis. It has to do with access to food. Am I exercising? Am I smoking? My built environment, air quality, water quality, lead paint, things like that.
Very good. Thank you so much for your time. We appreciate it.
My pleasure.